हेलो। 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 हेलो।
हाँ स्वप्निल जी, आपका आवाज आ रहा है।
हाँ। शुड वी स्टार्ट सर? हेलो। हेलो।
स्वप्निल जी, आपका आवाज आ रहा है, आप प्लीज स्टार्ट कर लीजिए प्लीज।
ओके। नमस्कार। भारत नीति की ओर से आयोजित माइलस्टोन्स ऑफ इंडियाज बैटल अगेंस्ट कोविड-19 इस एक्सपर्ट सीरीज में उपस्थित सभी मान्यवर, श्री पी मुरलीधर राव जी, वरिष्ठ नेता भारतीय जनता पार्टी एवं प्रभारी मध्य प्रदेश, श्री पी नरहरि जी, IAS ऑफिसर एवं कंट्रोलर एफडीए मध्य प्रदेश गवर्नमेंट, श्री GN राव जी, आउटस्टैंडिंग साइंटिस्ट एंड डायरेक्टर जनरल प्रोडक्शन कोऑर्डिनेशन एंड इंटीग्रेटेड सर्विसेज इन DRDO, श्री डॉक्टर उत्कर्ष जी बेटोडकर सर, who is a state surveillance officer in integrated disease surveillance program of गोवा गवर्नमेंट। मैं डॉक्टर स्वप्निल मंत्री, भारत नीति की ओर से आज उपस्थित सभी गणमान्य अतिथियों का एवं इस जूम मीटिंग के माध्यम से हाँ बोलिए ना। ओके ठीक है। हाँ हाँ कर रहा हूँ, ठीक है। हेलो। 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 हेलो।
जी यू आर ऑडिबल।
नमस्कार। आई एम ऑडिबल?
यस यू आर ऑडिबल।
हाँ, शुड वी स्टार्ट अनूप जी?
यस प्लीज गो अहेड, प्लीज गो अहेड।
हाँ। Bharat Niti is a public policy advocacy platform engaged in building opinion on policy matters, having an impact on various sections of society through research, dialogue, and campaigns. It is working with objective to evolve as a leading interactive forum consisting of online and offline platforms to spread information on various public policy matters, to focus on areas of economics, foreign affairs, governance and education, etc. It has organized various dialogues, webinars, and conferences to give important issues and discussion related to policies and ideological debates. Samvad, a platform by Bharat Niti, is to bring together volunteers in various cities and engaging in discussion on important issues. It has its own portal also, and it is working on digital generation content, governance projects, and parampara and various citizen journalism initiatives. Now we are today our motto of this expert series is in last 1.5 year, India has become Atmanirbhar in PP kit formation, vaccination, and other techniques which are helping in this COVID-19 pandemic to tackle this crisis. Now we are moving forward with this inaugural function. Our today's inaugural speech will be given by P. Muralidhar Rao ji. P. Muralidhar Rao ji is a senior BJP leader and in charge of BJP Madhya Pradesh. He has been worked as a National General Secretary of BJP from 2013 to 2020. He comes as a student activist from his initial life, and also worked as a organizing secretary in Swadeshi Jagran Manch. I request Honorable Muralidhar Rao sir to address us by their inaugural speech. Muralidhar Rao sir, please.
Good morning, everyone. Murali ji will be joining in another 2 minutes time.
Okay.
He's just finishing off another online meeting. He's just finishing it in another 2 minutes time. So he'll be joining shortly, just in 2 minutes time. Swapnil ji, Swapnil Mantri ji, please carry on.
Yes. Today we are going to discuss various state models like oxygen management in Madhya Pradesh, how Goa, being a small state, handle this COVID-19 situation very effectively, DRDO's success in temporary hospital to drug formulation, and Honorable Muralidhar Rao ji will guide us the journey of COVID-19 battle by India in various ways. Very soon, Honorable Muralidhar Rao sir will join and will guide us.
Swapnil Mantri ji, Murali ji will join soon. So we'll go with the next speaker.
Okay.
So we'll carry on with the session. Then Murali ji uske baad bolenge.
Yes. Then our first speaker for today's expert series is P. Narahari ji, who is a IS officer in Madhya Pradesh and controller of FDA. He is used social media platforms like Twitter and Facebook to solve the issues of common citizens. He has been recognized as a 10 most inspiring IS officers for the year 2017, and he runs an NGO called Alaya Foundation in Telangana. It's our great pleasure that P. Narahari ji has given their valuable time from their busy schedule, and today they are going to guide us on the oxygen management in Madhya Pradesh. I request P. Narahari ji sir to kindly enlighten us on the oxygen management in Madhya Pradesh.
Sabhi ko namaskar. Good morning to everybody. It's a great honor to be part of Bharat Niti series of lectures, and especially on the COVID management in view of the second wave that we are going through now. I thank Honorable Muralidhar Raoji for considering me to be part of this lecture series. And I thank Bharat Niti organizers to enable me to speak on what we have done in Madhya Pradesh in order to manage oxygen during this second wave especially. So through a presentation, a small presentation, I would like to go through and tell you about the story of oxygen management in Madhya Pradesh. Is my screen visible?
Yes, sir. Your screen is visible.
Okay. So in Madhya Pradesh, the second wave hit us very badly. And from the first week of April, the cases suddenly started increasing. And the rate or the speed with which the cases started increasing was so fast. And the Honorable Chief Minister of Madhya Pradesh, Sri Shivraj Singh Chauhan ji, took the entire program into his hands. And he started to work on this whole second wave on a very fast basis. So there were certain verticals which were brought in, that is certain verticals in the sense, verticals to manage oxygen, which was very, very important and which was very, very immediate requirement. Apart from that, medicines management and beds management. In this fashion, several verticals were created. And I was made part of the oxygen management vertical or oxygen management team in the COVID war room to ensure that we supply oxygen as cases went by. You can see here in March 2021, there were just 60 metric tons of air separation production units in Madhya Pradesh. About 110 liquid medical oxygen we were getting from other states, and just 11 tankers were being used for transporting oxygen into the state. I would like to mention here that in the first week of April this year, the cases in Madhya Pradesh was about 15 to 20,000. The active cases I'm talking about. And suddenly the cases started increasing so fast. And I was on 8th of April, I was told that I am being made the controller of Food and Drug Administration to manage the oxygen supply in Madhya Pradesh. So that is when we came in. And as you can see in this slide, that from 60 metric tons of our ASU, air separation unit is an independent self-generating oxygen plant. These are very small units. They produce about 1 to 2 metric tons of oxygen. So from 60 metric tons, we went to 120 metric tons in May. And from 110 metric tons of liquid medical oxygen, which we were getting to Madhya Pradesh from other states, we went to as high as 552 metric tons in May. And if you add these two from, that is 60 plus 110, from 170 metric tons, we went up to about 680 metric tons of oxygen we were giving to the entire state. So the way in which the oxygen control room functioned was to ensure we had to pull in all the possible resources from across the country to ensure that we get enough oxygen to cater to the needs of the entire Madhya Pradesh. So from about 15-20,000 active cases, we went up to 111,000 active cases, and that was about 31,000 oxygen beds. That was about in 111,000 active cases, nearly 31,000 patients were requiring oxygen. So how did we do this? What was the methodology that we adopted? How are we doing this? So a control room was brought in, as I mentioned to you, about 18 critical facilities. That is, medical colleges are the most critical facilities. That's what we would say, because maximum patients with oxygen requirement or who need to be taken care of very well who are being admitted in medical colleges. There are 5 districts of Madhya Pradesh: Indore, Bhopal, Ujjain, Jabalpur, and Gwalior, which cater to about 70% of the cases. So we identified these critical facilities and districts, and then we started working on the demand and supply. So we had the government of Madhya Pradesh Health Department created a Sarthak portal, which enabled us to calculate the data as to which district and which hospital was having what number of cases, and among those active cases, how many were being how many patients are on oxygen beds and ICU beds. So the demand was being calculated on the basis of this portal, and then we were also working on how to ensure that we sufficiently supply oxygen to those oxygen beds. Ensuring rational use of available oxygen. I'll speak about this point later on. And charting out a long-term sustainable strategy was what the oxygen control room in the war room actually we were doing. So as I was mentioning, the most important thing we need to understand is we need to get data, correct data of demand, and on the basis of demand, the quantification of the demand, we need to actually ensure that we supply enough oxygen to entire Madhya Pradesh. Madhya Pradesh is a vast state, 52 districts. We have about 8.5 crore population in Madhya Pradesh, and it is widely spread out from Mandsaur Neemuch touching Gujarat border to Singrauli touching Chhattisgarh border and Bihar and Jharkhand border. So we were to ensure that the demand quantification was properly happening, on the basis of which the supplier landscaping needs to be done. I will show in a subsequent graph as to how we were able to ensure that the tankers were brought in from different parts of the country to Madhya Pradesh. So mapping appropriate suppliers to the districts, and then allocation of oxygen sources according to the districts. So this is what we were actually trying to get to ensure that we are actually supplying oxygen to the districts on the basis of location of oxygen sources. I'll just show this map to you. In this map of India, you will clearly see that Gwalior, which is on the northernmost part of Madhya Pradesh, we ensure that we are getting liquid medical oxygen from Modi Nagar in Uttar Pradesh. And if you see Western Madhya Pradesh, this is Western Madhya Pradesh, Indore, Ujjain, Ratlam, this is Western Madhya Pradesh. We ensured that we were getting liquid medical oxygen from Jamnagar, Simej, Karjan, and Hazira of Gujarat. And if you see here, the eastern part of Madhya Pradesh, which has Rewa, Shahdol, and Jabalpur, we ensure that the liquid medical oxygen is brought from Angul, Rourkela, Bhilai, and all such places. The southernmost part of Madhya Pradesh, we ensure that we get liquid medical oxygen from Bhutiburi, Nagpur to Chhindwara and nearby places. So sources, identification of sources, and the sources to be mapped properly so that geographically minimum distance is covered by the tankers to get oxygen, and the turnaround time is time to fill liquid medical oxygen from the source, reach the destination district, and again go back. This turnaround time has to be minimum. So this is what we were doing, sitting in the oxygen control room to ensure that the turnaround time is minimum. See, the most important thing, I mean, we have been seeing a lot of criticism that Government of India has been facing as to what they have done to the states in order to mitigate this national disaster. How did Government of India come in to help states to ensure that the state governments fight this second wave very effectively? Government of India, for the first time ever, actually, if you have seen the map that I have shown, the sources where liquid medical oxygen is present is spread out throughout the country. Madhya Pradesh doesn't have a single oxygen generation plant, so we were totally dependent on other states for oxygen. For the first time, Government of India pooled in all resources, all the sources were clubbed together, and allotment of sources was done by Government of India. And that is how a state like Madhya Pradesh got 680 metric tons of LMO. If the Government of India did not help us, we would not have got liquid medical oxygen at all. So number one, source clubbing of sources by Government of India, and allocation of those sources to various states was done by Government of India. Second, tankers, provision of tankers for LMO transportation. Now, once we know the source, we need to bring the oxygen from various parts of the country. Government of India helped us identifying the LMO transporters. Who are the transporters who are having tankers with them? For example, they gave us a list of all the transporters of LMO in the country. So I spoke to Satyanarayana of Wind Gases of Vizag and requested him that you are having nearly 40 to 50 tankers with you. Why don't you please put few tankers and transport LMO from Bhilai or Rourkela or Angul? He was so helpful. He put about 8 of his tankers and he transported liquid medical oxygen from Rourkela, Bhilai to Madhya Pradesh. So this is how Government of India helped us in identification and clubbing of all the LMO transporters and providing those tankers to us. Next thing was cylinders, additional cylinders. We required huge number of D-type cylinders so that the cylinders can be used. The cylinders were easily the cylinders were easily filled and distributed to the hospitals. So this is where Government of India once again helped us in ensuring that we get maximum number of additional cylinders. Now, two of the best things that Government of India did was bringing in Indian Air Force. Indian Air Force for the first time was brought in to airlift empty tankers from Gwalior, from Bhopal, from Jabalpur, from Indore to various source points. So this ensured that one side transportation time by road is minimized. This is the first time that Indian Air Force was brought in to airlift tankers, empty tankers. And the other thing was oxygen expresses. Railways was put in to transport LMO tankers. So the data that I am showing you here is that you can see that Indian Air Force used 129 tankers were airlifted by Indian Air Force to the capacity of about 1700 metric ton. 66 tankers of oxygen were brought by Indian Rail through Oxygen Express. So these are the various initiatives that ensured Government of India's help and state government's effort put together. We ensured that we tackled this enormous crisis together. If you can see in this slide how Madhya Pradesh has been able to handle the oxygen demand supply. So as I was mentioning, on 10th of May, we had about 1,11,000 cases, active cases. The demand was, oxygen consumption was about 526 metric ton. And today on 2 days back, the oxygen consumption fell to 265 metric tons. And with whatever was the demand that was being raised by various districts, we were very comfortably able to supply so much of oxygen to the entire state. This slide I have explained. So other significant steps that Madhya Pradesh took was installation of cryogenic tanks for storage of LMO. See, we can bring LMO, liquid medical oxygen, from various states, from various sources, but we need to have tanks, cryogenic tanks, to fill them and then supply oxygen to various hospitals and districts. So installation of cryogenic tanks was very, very important. I showed in the slide also, we increased the production of ASU, air separation units, from 40 metric ton, we increased to 170 metric ton. We formulated oxygen and fire safety guidelines, and this was issued to various districts. Now, this is another important sheet where Government of India has done, I would say, has done an excellent work when it came to judicious use of oxygen. Correct and genuine use of oxygen is very, very important. Government of India, under the in Ministry of Health and Family Welfare, they came up with a committee to ensure what should be the judicious and correct amount of oxygen that should be given to a COVID patient. So they came up with these norms saying that 10 liters per minute is the oxygen flow, that should be the oxygen flow for oxygen beds. And 25 liters per minute should be the flow rate for ICU or HDU beds. Now, this is the very, very important aspect that we need to understand. And Government of India ensured that all the states did oxygen audits. A patient should never be given more oxygen than what has been prescribed by this expert committee. There were many hospitals in Madhya Pradesh alone which were giving excess oxygen to the patients unnecessarily. So we created this oxygen audit system in Madhya Pradesh. We formulated oxygen audit committees in each of the districts. Oxygen audit was done twice in a week. And there was a review with district collectors on the oxygen audit, orientation of the entire medical staff to ensure that judicious and correct use of oxygen is done, and updation of all those things on our Sarthak portal was being done. If you can just see this slide where one district, Khandwa, the district collector took this whole thing very, very seriously, and when as per norms, when oxygen was being given, Khandwa district's demand drastically reduced by about 70%. So Khandwa became a role model of oxygen audit in the entire country. So we need to have a long-term strategy now. We need to have a long-term strategy in the sense that now we are realizing there are so many talks, there are so many experts are mentioning that there is going to be a third wave, possible third wave. Whether there's going to be a possible third wave or not, what is required is that we must be prepared. At any cost, we must be prepared for, we must be prepared to ensure that the next wave, whichever is going to, if it is going to come, we need to ensure that the next wave we tackle very, very effectively. So in that process, I would like to mention that the state government of Madhya Pradesh is coming up with oxygen facilities, creating new facilities in each of the districts of Madhya Pradesh. These are the various places where we are already preparing to ensure that we have enough of such facilities. Liquid medical oxygen production in the state also is being enhanced, and that is also what we are working on. Data management systems are being taken care of. As I mentioned, we should be prepared. The kind of second wave that we have seen, it has been very fast. It has been very fast, and the second wave has been so fast that we had to pool in all our resources to ensure that we strategize ourselves and ensure that relief is provided to all the districts and hospitals. At least for now, from now onwards, if at all there is going to be any more waves in this country, in our state, we should be fully prepared to ensure that we tackle this in any kind of wave in future. So we are creating a data management system. We are creating a portal to ensure live tracking of tankers with GPS, forecasting of potential supply in next 24 hours, distribution plan details for tankers going to each and every district. So in a way, on the basis of the kind of second wave that we have seen, now we are fully gearing up for any such wave that is going to come in near future. Thank you so much for giving this opportunity to me. I mean, if at all there will be any questions, I'll be very happy to answer, maybe whenever there is a time. Thank you so much. Yeah.
Thank you, sir, for your valuable inputs on oxygen management in Madhya Pradesh. You have set a new benchmark for ensuring oxygen in a very effective way. We are again thankful to you for your valuable inputs on oxygen management. Thank you, sir. Now I request P. Muralidhar Rao ji, sir, senior BJP leader and in charge of Madhya Pradesh, to give their inaugural speech to all of us.
Thank you, Dr. Swapnil. Thank you, Bharat Niti platform, for organizing this very, very important information exchange event to understand the successful experiments undertaken in different states by, am I audible?
Yes, sir, you are audible.
Okay, thank you. So now before me, Shri Narahari ji, who has taken the responsibility of organizing oxygen supply management and other related aspects in Madhya Pradesh. And he has explained how this particular oxygen supply management has been handled appropriately, and how by utilizing all the sources and also the government, central government and state government support systems, how he has been able to work out a successful model in Madhya Pradesh. Now, before getting into different aspects, I would like to highlight few important things. Now everywhere discussion is going on, and we have a vibrant democracy in India, and we also have multiple parties functioning in this country, and different countries, different parties are ruling different states. It is not a single party ruling every state. So we have a central government run by a different party, and we have different parties running different state governments. So we have a federal structure, also have a central government to help different state governments. And we also have understood now, health being the important state subject, and state governments are expected to regulate and undertake different exercises. So the battlefield is definitely under the state government, and state governments are expected to successfully steer this movement. And of course, the central government has a definite role to support the state governments in this war, in providing resources like oxygen supply, or the critical medicines, or the vaccination, all the vaccines, all these things are definitely, expected from the central government to supply to the state governments. So we have a governance framework different from other countries, and in this model we have worked out. This kind of a crisis we had never seen. We had faced different crises, cyclone, tsunami, or other things, and even COVID first wave we had seen. But this COVID second wave is a different crisis we have, been managing for the last few months. Now, being a vibrant democracy, definitely you have political parties criticizing this party, criticizing another party, or the other party criticizing the party which is governing at the center. And when we have multiple parties, definitely, based on their perspectives, based on their political interests, based on their angle of experience, they are, participating in the discourse. That will be there. Today it is there, and tomorrow it will be there. When you go to the bottom, definitely underneath the surface, you have, there is a coordinated functioning, irrespective of the struggle, quarrel, and political rumblings. At the bottom level, everybody is coordinating with each other and trying to help the community to successfully face this crisis. In this whole thing, there are few models which are discussed for their successful handling. For example, Kerala, under the Honorable Minister of Shailaja, there has been discussion how this oxygen is procured in a successful way, understanding, anticipating this oxygen demand, and how it is going to affect the second wave and how it is going to affect the patients. Understanding that Kerala minister, under the minister, the bureaucracy and everybody, they worked out a model, and that for that purpose, now the Kerala model is discussed everywhere, particularly in terms of the oxygen procurement. Now there is another model which is discussed, Mumbai model. We have seen the Mumbai has always seen the peak, and the crisis was very serious, and the number of getting affected were very high, and there was a stress on the hospital infrastructure, there was a stress on the oxygen infrastructure and every kind of infrastructure. In such a situation, utilizing the information technology and other technological tools and creating a dashboard, how Indian, under the Iqbal Singh Chahal or whatever the team which has worked out, now everybody is discussing how they have been able to utilize the scarce resources available for the benefit of everybody, and how they have reduced the pain and stress. This also is now discussed, and definitely it is going to help us, the model which is discussed in the context of Mumbai. Now third, now Narahari has explained how the oxygen, particularly how optimally the Madhya Pradesh is utilized. Another thing which is not discussed and which is going to become a model is, in this lockdown situations, Madhya Pradesh, they have experimented a different thing, for the lockdown and even for the unlocking. Now it is a participatory model at the village level and at the town level and at the district level and also at the state level. A crisis management committee is formed, and in that public representatives are also involved. Even in the village, sarpanchas are involved, and the local leaders and social workers have been involved. So they are going to take stock of the situation, and based on that, they are taking decisions when to lock up, lockdown, and when to go for unlock, and how much. All these things, government is definitely taking decisions, but based on the participation of the society and civil society groups and representatives. This model is also, because it's going to have a long-term impact, and we are going to have, this kind of COVID situation is not going to end immediately. So in such a situation, Madhya Pradesh has worked out crisis management group with the participation of the civil society and also the public representatives, not just belonging to government, but other people. So this also is going to become a role model for other states. So this is also very important. Now, in terms of, we also have other models. For example, in Uttar Pradesh, increasing the testing, and in all over the country, increasing the testing, irrespective of wave going to peak or wave coming down, but not reducing the testing. So this, and because of this increased testing and how Uttar Pradesh has been able to bring down, it's a populous state and we had a very serious problem. And in such a situation, how the Uttar Pradesh model has worked out. So all these things, I'm not going into every model discussion, but definitely these models, maybe in the context of oxygen, maybe in the context of remdesivir supply, maybe in the context of vaccine, and creating now vaccine also, different states are creating models. You have a limited supply. When you have a limited supply, which are the priority groups? Who are the frontline workers? How to create a priority groups, and based on that, creating a hierarchy of the target groups. In that, they are going so that to avoid the confusion, in order to avoid the rush and long queues and all, state governments are really preparing the priority list depending on the availability of the vaccine. So all these things, we have different models getting evolved every day, maybe because of the initiative of the government, maybe because of the initiative of the bureaucracy, maybe because of the initiative of the opposition demand or suggestions. So it is an evolving process. This is happening. Now, I would like to, so all these, models of, this kind of experiments which we have done are going to help India in its learning process and ultimately a replication value. So, successful models can be replicated. And these models have a value for the future governance. Because in our country, governance is not a static thing. And as democracy is becoming very active and very vibrant, definitely our governance is going to get impacted with these things. So definitely these models are going to become useful in making governance at different levels more impacting and more effective. So for that purpose, the Bharat Niti event management on organizing on the successful models to discuss. This is a very important thing. Now coming to the point, another vaccine is going to be a very important issue, and vaccine rollout models also. Different states are doing different experiments. Definitely in coming days, this is a very important thing. We all know, vaccine is seen as the panacea. Vaccine is seen as a solution. You have different problems. And ultimately, everybody is talking about there is no medicine other than vaccine. Today, vaccinating the people is the solution. So reaching 100 crore population or reaching 110 crore population is the important and the primary target for the central government and state governments. There may be discussion, what kind of a rollout and how, when is vaccine ordered, first ordered, second order, whatever it is. Now, there is a consensus. Central government has declared by the year end, we will complete the vaccination reaching to 110 crore population. This is all now declared. Now, who is going to, whether Covaxin, Covishield, Sputnik or other things are going to come and how this is going to get accelerated. But definitely in coming days, when you roll out, different state governments have to prepare a chart of priority sections, and accordingly they have to go for vaccination, and vaccinating all is going to become important this thing. Now in this, to avoid confusion and to avoid wrong discussions, we have technology and we can utilize GPS location, we can utilize the dashboards, and we can every day evening, how many people in each counter and how many counters people got vaccinated, and who are the people got vaccinated. All these things can be declared so that the wrong discussion will not be there. And finally, a very important point, definitely in coming for the crisis, where, if we have, nobody feels that we should have a crisis kind of situation, but for the future crisis, definitely there is a discussion on the fatality. The people who are, because of the COVID, how many people are dead. This is becoming a very serious contentious issue. And, if you carefully follow, the number of dead is not calculated by the central government. It is not prepared by the central government, or it is not prepared by some one party government. The entire country, for example, one political party running the Kerala government, they issue at the national level statement, it is underreported. And in the same Kerala state, BJP leader says the Kerala fatality rate is underreported. So these are political statements. Leave about the political statements. Ultimately, if you see, even at the global level, the discussion is going on. It is not only in India, even it is not just in developing countries. It is not in African countries. It is not in Latin American countries. Even in America, the underreporting is there. This is the problem of, entire humanity. This is the problem everywhere is faced. Somewhere it is 2 times, somewhere it is 3 times, somewhere it is predicted 4 times, 5 times underreporting. This is a problem everywhere. So instead of giving, apportioning this problem to any political party, in coming days, we have to address this problem. How to create a procedure, how to create a scientific methodology to ultimately calculate in an accurate way. So this is the problem. If you call any village, what is the fatality? They will say 3 people, 4 people, 5 people are dead in each village. We have 6 villages. If that is the truth, then it cannot be 4 lakhs. But then you cannot blame a single party. And the dead number is not reported by one single government at the state level, different state governments. And the percentage of the fatality also not different in different states. So instead of blaming one political party, in coming days, we have to create, how to capture this number accurately. What can be the methodology? These things we have to evolve. And in coming days, this using the technology and by, exchanging these successful models. Now, Bharat Nidhi is organizing this, program to share these things. But my view is central government, and through different ways, it can, circulate the successful models to different places. But this is a successful model. It is implemented and you can learn from it. And this is a successful model. They have done it and you can implement it here. So this way, this can be circulated in a broad way and everybody can be benefited. And in coming days, definitely our country. Now, there are different examples now being discussed. Taiwan has successfully handled. New Zealand has successfully handled. Singapore has successfully handled. Definitely, we must appreciate those countries. And if there is something to learn, definitely we have to learn. But I would like to mention here, these countries, whether it is a geographical expansion or the density of the population or the diversity of the population and the kind of diversity, ecological diversities, all these things, if you see, India can never be compared to or Taiwan or New Zealand. India is a world in itself. And we have rich people, we have super rich people, we have poor people, we have tribal people, we have educated, we have uneducated, and we have remote villages, and we have high altitude places like Ladakh and all. So this is a world in itself. And the problem, if we are able to solve successfully, then it is a problem resolved at the global level. So, our, the ability to solve the problem is very critical. in addressing the problem at the global level. So my appeal to all of you is, in coming days, leave about the political differences. I don't say we will not have political differences. Don't think that we will not have political confrontation tomorrow. We will continue to have those things. But even yet, even at that time, we should be able to handle the problem in a more effective way and more scientifically and more accurately and in an optimal way. Whatever the scarce resources we have, we should be utilizing in an optimal way. Definitely, for the first time, we have utilized certain things in a very swift way. As Naraharji just now told, utilizing the Air Force and utilizing the Navy, utilizing the railways. For all these things, we have never done like this. So definitely in coming days, we must be looking forward to do and integrate all these things in more effective way. Thank you, Bharat Niti people, for organizing this kind of program. And definitely in coming days, more such programs will be organized to improve the confidence level of the society and nation. Thank you.
Thank you, Rao sir, for your very inspiring inaugural speech. Indeed, vaccinating for all is the need of hour. And as you said, we will all follow the path you shown. And thank you for guiding and sharing the successful stories across the India and abroad also. Thank you, sir. Our another speaker, Dr. Bhargavji, ICMR Head Director General, intimated that they will join shortly as they have meeting with Honorable Finance Minister. Till the time, our next speaker is Shri G.N. Raoji, who is an outstanding scientist and Director General in Production Coordination and Services Interaction in DRDO. He was the part of Project Akash team from beginning and awarded the Agri-Path Breaking Award for indigenous development and production of Akash missile system. He was appointed as Project Director NG-ARM, and he is a life member of INS-ARM and Square Societies. I request Honorable G.N. Rao sir to enlighten us on the DRDO's role in temporary hospitals to drug development and also share their success stories. G.N. Rao sir.
Thank you, Swapnil. Namaskar, Bharat Niti. Good morning, everybody. And thank you. Namaskar, Muralidharanji. So Muralidhar Raoji has given the inaugural brilliant speech on the COVID fight Bharat is making and the future steps which we can take collectively to fight the COVID. It was very inspiring. So I am here to share DRDO's technological contributions for fighting the COVID in the country. And at the outset, I thank Bharat Niti for giving me the opportunity for speaking about the DRDO's contributions for COVID on this platform at the national level. When we had the first wave in 2020, there was a huddle. I mean, suddenly there were no sanitizers, there was no masks, ventilators, because till that time they were used very scarcely. You know, masks are used only by the surgeons and the doctors only. Normal people never used any mask. So production was less. And everything was imported from China. Many Chinese products were used till that time. And suddenly, because of the lockdowns everywhere, this has choked. The supply line from the international markets have choked for sanitizers, ventilators, masks, PPEs, etc. Then Secretary DD-R&D, Dr. Satish Reddy, was made member of the group of secretaries for evolving methods to combat COVID, and they have brainstormed. Then there was an internal discussion to how to apply defense technologies. DRDO in general is the technology powerhouse for the country for doing the defense products. So we have different technologies in chemical, mechanical, electronics, and different domains and aerospace. So how to apply these technologies for the COVID and for the common man to counter these scarcities which suddenly have cropped up. So immediately we have gone to our life sciences labs and chemical labs, and we have created a WHO compliant sanitizers, so that because sanitizer is the basic necessity at that time, each COVID warrior, either health, police, and people, they wanted a sanitizer, and there was a heavy scarcity. Nobody was having. So immediately we have made these sanitizers in bulk, both alcohol, non-alcohol, and herbal ones, completely WHO compliant, and distributed to all these people. And simultaneously, 75 categories of these various products which are developed, and hundreds were provided to more than 150 industries through TOTs. And government was approached to relax all the TOT norms. Normally, any technology transfer in the country would have taken a year or so for completing the formalities and enabling the industry to start producing based on any TOT. But
sir,
during
sorry, please start your video, sir, on your video. Rao, sir, please. Sorry to interrupt.
Thank you. I thought you have disabled it. Okay. Now is okay?
Yes, sir.
Yeah. So basically, DRDO has various technologies for the various defense equipment. So they were quickly adopted for the COVID use. Similarly, ventilators. And there were ventilators only imported at that time. There was no indigenous manufacture of the ventilators at that time. And DRDO was making these for the defense applications and identified 1 or 2 industries. Then immediately, Secretary has taken a decision and roped in Bharat Electronics in a big way, and the technology was given to them, and they have made in a month time 30,000 ventilators and pushed into the market to alleviate the surge in the demand. So now you can see in the second wave, there was no problem for the ventilators and nobody was asking. In fact, many ventilators given by the COVID hospitals and centers by PMKs were lying unused because of the lack of knowledge. So that scarcity was taken care by the technology solutions. Likewise, masks and PPEs. So we have immediately approached all our textile industries, and we have few labs who are specialized in military clothing. So they have been roped in to design these PPEs and masks for the general purpose use. Immediately, we identified a number of industries and gave TOT and enabled them to produce in lakhs and certified, because these products have to be certified for the medical use. And those certification centers also have been identified in our labs. And we have certified number of industries so that they can manufacture and be utilized in the public. So that effect also you can see in the second wave. When you have established these industries, they all have produced in lakhs. And in the second wave, we didn't have any scarcity of the masks, PPEs, and all have been produced indigenously. Now we not have to get it from China and other countries. The dependency has been alleviated. And COVID testing is also new at that time. Everybody knows COVID, but how to test was a problem, and not many centers were available. So DRDO labs at Gwalior, Jaisalmer, Jodhpur, and Northeast, wherever these labs are there, they have been enabled to test the COVID. We started with our own scientists and their families to be tested and cleared in those centers. And later we have extended this facility to the public also. Now in the second wave, there is an automatic process in Delhi and other places. Public can book their testing slot online, go there in the morning, get tested, and get the certificate online for this COVID. So this enabling widespread testing, as Dr. Muralidhar Rao ji has just now pointed out, testing should never stop. So we should do widespread testing to identify people so that they can isolate themselves. Otherwise, the spread will be much more. So the criticality of the testing has been identified, and DRDO took steps to make this thing. DRDO has got in their life sciences labs this BS2 certified laboratory. So where you can test these virus and other bacteria and all those things. Those facilities have been utilized for testing these COVID RT-PCR. And DRDO BS2 labs have done immense service during this time, apart from their normal R&D activities, to do this COVID testing. And in the second wave, the scarcity was different. In the first wave, which we have taken care for these sanitizers, masks, PPEs, ventilators, testing, this has definitely came in hand to immediately address the needs of the people. In the second wave, new challenge has come, as earlier speakers have pointed out, oxygen supply. Second one is COVID beds. So hospitals were overwhelmed too much so that there were no beds available. So with the construction experience in the specialized systems for the nuclear, biological and warfare systems, we erect quickly shelters for many people for taking the shelter during the different stages of war. Those technologies have been brought in, and quickly how to erect a large patient complex for fighting the COVID. So that has been experimentally tested during the COVID one time in Delhi, and 1,000-bed hospital was erected within 10 days with 250 ICU beds, with ventilator, oxygen, built-in oxygen support, and everything, free food and free treatment. And all the admissions were routed through the Health and Family Welfare Ministry. So once they certify a patient, he can walk in with that certificate and get admitted and get treated freely in these hospitals. That hospital was wound out around February time, thinking that there was no demand, because after December, there was no demand and hospital was lying vacant, and government asked to wind up. And when we are winding up, suddenly in March, this second surge has come. So immediately the Delhi hospital was revived, and 500-bed hospital was immediately created to take the demand out of the other health support systems in the state. Otherwise, Delhi hospital demand was too high and people were not finding even beds, and they are not able to manage at home oxygen and other supplies. So this 500-bed hospital came very handy for the public, for the defense employees, for the services people and their kith and kin for getting treatment and cured in these hospitals. So this is a concept which was replicated in 10 other places. Each state has come up with their demand. So hospitals right now have been established in Allahabad, and it has been established in Lucknow, established in Varanasi, in Uttar Pradesh state, and UK, Uttarakhand state, in Rishikesh also we have established a hospital. And other states, wherever a demand is there, we have been going. Bihar, there are 2 places, Muzaffarpur and Patna, we have established a hospital. These hospitals have been established by DRDO, but run by the doctors from 3 tri-services, Army, Air Force and Navy, or the paramilitary forces. So they are professional doctors, they will run the hospital. Infrastructure and the technical needs like oxygen, sanitation, water, all those things have been taken care by DRDO designs and DRDO construction expertise. In the second wave, first wave has seen oxygen slightly surge was there for the demand, and oxygen production has been enhanced. But in the second stage, the distribution system, as Narahari ji has pointed out, and the steps are taken for the distribution of the oxygen, second stage has seen a demand for the cylinders, because people wanted to have cylinders at home also, because many people are not getting beds sufficiently, and they were advised to treat themselves at home. For that, 10 liters cylinders, small aluminum cylinders with regulator and other accessory are required for patient. You know, it was exorbitantly sold. People have black marketed and all those things. So for this situation also, immediately DRDO has applied their technical prowess and identified the industries to make 1 lakh aluminum cylinders of 10 liters capacity with SpO2 monitoring. And as Narhariji pointed out, wastage of oxygen was too much. People were not knowing how to control the usage of oxygen per patient. This cylinder will come with an automatic regulator to control the oxygen supply to the patient. If it is excess, it will cut off. If it is less, it will increase the pressure and flow. So this controller was also developed. And now by this month end, we are going to get a 1 lakh cylinders into the public space, and few more lakhs of cylinders will come, so that in the public domain, there is no lack of cylinders, or demand will come down, black marketing will come down, and the artificial scarcity which is generated by the people, that also will come down. That's how the technology has been applied to make aluminum cylinders. Likewise, big cylinders, 47-liter cylinders also, which are used in hospitals for making oxygen bank, they also have been ramped up, and industries have been brought in, new industries, because the current capacity is not able to meet the demand. Normally, oxygen is not used by everybody, and 1 or 2 cylinders will be used for emergency patients. So hospitals have also not geared up, production also not geared up, filling plants also not geared up. So all these have been technologically now upgraded, so that now whatever situation happening in southern states, we are able to handle better based on the experience in the northern states by providing the technological solutions from the DRDO side and improving the industrial capacity. Further, the oxygen plants, the generation system and the transportation system could not meet the demands, and a lot of methods have been evolved to reduce this demand on the transportation system. The group of secretaries have found out that DRDO has developed an onboard oxygen generation system for aircrafts. So that is a very small plant that can be upgraded to a large scale and given to industries, so that each hospital can have their own oxygen plant in the capacities of 250 liters, 500 liters, and 1000 liters, depending on the patients in the hospital. So these designs have been immediately upgraded and given to the industries, and immediately within a week's time of Honorable Pradhan Mantri's call, 5 plants in AIIMS Jhajjar, AIIMS Delhi, and RML, and Lady Hardinge Medical Hospital, and Safdarjung Hospital, they have been airlifted, fabricated there, airlifted and installed in Delhi. So that now Delhi, you can see there is no lack of oxygen, and demand has been met through these cases, because always you have a generation plant as a backup for storage. If storage is going down and transportation is not able to provide in time, the generation plant will take up further to cater for the surge and the continuous demand of the hospital, so that no patient dies because of the lack of oxygen in the hospitals. Then you can see the recently whatever we have launched, 2DG drug. It is found to be very effective, and this effort has been launched during the last COVID period, 2020, and a series of testings have been conducted, phase 1, phase 2, phase 3 trials for this, and the drug controller has given a recently clearance for this drug for adjunct use, and this has been launched, and this has been tried on many patients and found to be effective. And as we have seen in the public domain now, the production agency, Dr. Reddy Labs, has already fixed the drug price very low, and it is going to come into the market for public use, but through hospitals and prescription only. It is not across the counter. So they have made a portal, so hospitals can directly apply to them and get this medicine and use it for patients, which reduces basically the oxygen demand in the body and counter the growth of the virus in the body, so that body can naturally fight the other symptoms and cure can be faster for the COVID patient. So this has helped many patients as we get the feedback from the patient tested in different hospitals in Delhi, Hyderabad, Patna, Lucknow, and different places. Wherever people have asked, we have provided the medicine and they are giving them feedback. For testing, now this is becoming a lengthy process because people want immediate results to travel, to take clearances and all those things. Now, DRDO lab in Delhi, they have generated one rapid test kit, DIPCO-1, rapid and reliable antibody test kit in a cost-effective and quick way to find out the virus load and the antibodies in the system so that you can be certified negative or positive or whatever it is, so that people can immediately take action, get isolated if they are positive. If they are negative, they can resume the activities without waiting and they can travel also. So they can do at their home these tests, and test kit also will be priced very economically and affordability will be there. So people can use in different walks of life. That's how DRDO has put their technologies to the use of the country's management and fighting for the COVID. In this, Secretary DD&D, Dr. Satish Reddy, has taken enormous effort, positivity, and pushing or diverting our DRDO manpower and the attention for a short time to this COVID fighting efforts. And we are successful. And we are happy that we could provide whatever a little way to alleviate the problems of the people. It is enormous suffering, as pointed out by Dr. Muralidhar Rao. So we could do our bit through our technological solutions. And I just wanted to share this much. And dhanyawad. Thank you, Bharat Niti.
Thank you, Shri G.N. Rao, sir. We are all happy to know the success story of DRDO, which is making India Atmanirbhar by decreasing dependency on other countries. We hats off to you and your all team members for your this dedication and outstanding work. Keep it up, sir. And thank you once again for joining this session. Our next speaker is, and this is our concluding session. If participants have any questions, they can put in chat box. So after this session, we will take the question answer. Before going ahead, I will introduce Dr. Utkarshji Betodkar sir, who is a state surveillance officer since 2010 in handling the integrated disease surveillance program in Goa. He also handled National Rabies Control Program, National Iodine Deficiency Disorder Control Program, National Program on Climate Change and Human Health at state level under the Directorate of Health Services, Goa. As an in charge of IDSP, he has been involved in influenza A, H1N1 outbreak monitoring, preparedness for Ebola virus disease, PHA, etc. He is also involved in the fight against COVID-19 since day one. He is a young nodal officer of Goa State and epidemiologist. I welcome Dr. Utkarsh Betodkar sir and request them to address us on the Goa COVID management protocol. Dr. Utkarsh sir.
Good afternoon, Dr. Swapnil.
Yes, sir. Good afternoon, sir.
Am I audible?
Yes, sir. You are audible.
Okay.
Proceed,
okay. Dr. Swapnil, thanks a lot. At the outset, let me thank Bharat Niti for giving this chance as a speaker on this platform. And let me share my presentation. Dr. Swapnil, is it visible?
Yes, sir. It is visible.
Thank you so much. And good afternoon, everyone, all the participants for this event. And I'm Dr. Utkarsh Betodkar. I'm a state surveillance officer under IDSP. And IDSP is Integrated Disease Surveillance Program. And to let you know, IDSP is a program all over India in various states. This is a program which monitors COVID-19 situation in their states. Be it any outbreak or pandemic or epidemic, this is a program which monitors the surveillance part of any disease. So basically, my presentation will be more about the surveillance of COVID-19 rather than coming to smaller or detailed technicalities. So to start with, let me just brief you about, in short, about geography of Goa. I guess everybody knows about Goa because Goa is looked at as a beautiful place, as a tourism state, or every other person would like to come to Goa and enjoy their holidays. But then at the same time, I can just put you some things like Goa is very small state, okay, and traditionally very rich, having a population somewhere around 15 lakh. 15 lakh population is, if you see a bigger states, it will be a population of a small area, a small taluka also. But then that's what our population is. Goa is divided into 2 districts. We have only 2 districts. One is North Goa, one is South Goa. We have around 12 talukas. Now, we definitely cater to 15 lakh population, that is, our population. But at the same time, I would like to, just brief you that any given time, we have another floating population, majorly a migrant population or migrant laborers, which are maximally from North India or Middle India. And this population is almost, I would say, equal to around 15 lakhs. And at the same time, we have tourists, which is much more than our population. And the tourism season is somewhere starts from November, and then ends by somewhere around January, February. But then some floating tourist population remains throughout the year. So if we actually see, we cater to a population when it comes to a health infrastructure, we cater to a population much, much larger than the population of Goa at any given point of time. And with this brief about our geography, let me take you to our journey to control COVID-19 in state of Goa. Now, everybody were talking about Goa in first wave, and the talks were more about how Goa could remain green for a long. Okay, and what I can present to you is Goa started the working for COVID-19 right from early January 2020. That's when the story started in Wuhan in China, and we were continuously monitoring their data through WHO or various sites, and then we were briefing our peripheral health institutes or even our major hospitals, so that we were prepared to tackle any eventualities. And with that preparedness, we could get our first suspect, I would say, on 26th of January 2020. We took all precautions, what we are taking even now for even that suspect. And we admitted him in isolation. We sent his sample to NIB Pune. And that was a time, I think very few states had a facility to test for COVID-19. And even Goa was not prepared for testing of COVID-19 at all. So we had to be dependent on NIB Pune. This was a couple who had come from China, definitely, and presented with sore throat and fever. But then this particular person, the male person, he was negative and his wife was negative too. And then after that, we, even in February month, we got a lot of suspects. We tested them, we isolated them, but none of them were positive. Luckily, till 25th March 2020, Goa was completely green. We didn't have a single case. And on 25th March 2020, we had 3 cases of COVID-19, confirmed cases. Now, all these 3 cases of confirmed COVID-19 were travelers. And we could get all these details because, much earlier, because we were quarantining everybody at that time. We were coming from outside as per the Government of India norms. And this quarantine was done, so well. And it was, we were giving our 100% not to leave any stone unturned that time. And that is how we could catch all these 3 cases and we could isolate them, treat all of these cases. And by end of March, we got another 4 cases and total of 7 cases that time. Out of 7 cases, we had 6 who were travelers, and the 7th case was a brother of a positive traveler who helped him in transportation from airport to the isolation facility. Now, all these 7 cases were treated well, managed very, very well by our tertiary care center, medical college, and all 7 cases recovered well, went home, and even after recovery, they were again quarantined for 7 days, and no more cases were found after that. A best part happened for Goa was even before we could get the cases, there was a national lockdown which was already declared, and entire state was into lockdown. And for a long time after that, we did not get any cases. We started our cases again on 14th of May, where suddenly in one of the locality, one of the slum locality, we got around 8 cases, and from there our number of cases started coming up. And in that particular slum area, which is close to the airport, Goa airport, and we started an outbreak there. And after almost a month, when we did a sero surveillance there, almost 20% of the 19 to 20% of the population was positive there. We could manage it very well that time. Still, all this while we were managing very well contact tracing, quarantine and isolation. We were definitely going by Government of India's strategy, where they said, test, track, test, treat, okay, and isolate. And we were definitely going as per that. This is a slide which is showing us, about the health infrastructure in Goa. This is a normal health infrastructure in Goa, I would say, not for COVID. Leaving COVID aside, we have only one medical college in Goa. That's Goa Medical College, Bambolim. We have 2 district hospitals. We have 2 sub-district hospitals. We have 6 community health centers. We have 19 primary health centers, and we have 4 urban health centers. This is the infrastructure which is there in a government setup, and there are many of private hospitals too. But then this layout of these centers is done in such a nice way that our network is very good. A person can reach from any of the most peripheral part to our district hospital or medical college within 45 to 1 hour. And our system of ambulance services and transport is excellent, in one of the best in country. And now definitely our response time is decreased because of COVID work too. But then our response time was one of the best in country, and that's how we could manage entire network of transportation of patients. Now coming to this first wave, as I said, we started initially in March month with those 7 cases. After that, we were green, in a green zone. And then somewhere in May month, middle May, we started with orange, and then definitely we also went in red. Okay. And what definitely helped us, went wrong, or why we started getting these outbreaks in slum areas, is even at the entry points at roadways, we were testing everybody except drivers who are, who get in essential services. And probably that is where we missed it, and the virus came in from there. That is what our explanation only we can think of. Then looking at this wave, the first wave, our first wave peak was 19 September 2020, where we had maximum active cases of 5,920 cases. And at the same time, we had even our maximum deaths. So deaths were around 61 deaths in that particular week. Now, coming to what different we did, the home isolation kit introduced by government in Goa, somewhere in August, to be precise or exact, it was on 10th of August 2020, when free home isolation kit was introduced by government of Goa, where a home isolation kit which included a pulse oximeter, thermometer, all medication, including required antibiotics, your multivitamins, vitamin C. It had mask, gloves, hand sanitizers, and various other things. So it was a nice pack of a home isolation kit, which was introduced at midway before the peak of the first wave. And I think this definitely helped us to lower our death rate as well as our hospitalization rate, because we could because people were using pulse oximeters, they were taking readings 3 times a day, and it was the readings were given to a team which were monitoring all patients who were under home isolation. And this helped us to move patients at the earliest to nearest hospital and give them the appropriate care. I think this was one of the different other states. And then slowly our peak from September onwards, it came down to the lowest number. We went to even 30 cases per day. And that's what somewhere in week 6 of or week 7 of this year 2021, which is exactly around end of the February 2021, wherein for a week we had 327 cases only. So if we compare, in a peak we had 5,920 cases in a week, and then when we went down with the first wave, we had only 327 cases. Now from here, from 327 cases, we slowly started rising with the numbers. The numbers which we were getting around 30 cases per day started rising to around 40, 50, 70, and then even reached to 100 in a day. So we were definitely coming up from there. And this is a time when we alerted all health services again, the peripheral health services, our hospitals, and definitely all our hospitals which are put in place, at least April month to get end. And why April month is because every year, every second year when we get H1N1 outbreaks, we observed that, we get more cases in the month of March, April, and May. And that is why we were thinking we might get a second wave during these months. And we were waiting to come down with the number of beds, everything, if at all we don't get cases in March and April. And good that we waited and we were hit with second wave. This was the number of deaths, week-wise number of deaths. The maximum deaths which we saw in September month again, 2020, were 61 deaths in a week. And somewhere in the end of February, along with our number of cases, even our number of deaths started rising. Now, this is the status as on 27/5/2021. Okay. Now, samples tested till this date was 8,07,550 cases tested samples. Positive cases total from first wave and second wave are 1,52,401. Recovered cases are 1,34,164. Deaths 2,538. These are the total deaths from first wave and second wave. Active cases as on 27th are 15,699. We are definitely on downturn from second wave. Our recovery rate is currently at 88%. Test per million is definitely, because looking at our population is much higher in all over the country. Positivity rate is 18.87%. Death rate is little high in Goa, is 1.6% overall. One of the reasons for death rate is our deaths, the maximum deaths are with comorbid conditions. Out of 2,538 deaths, we have 1,939 deaths which have comorbid conditions. And the major comorbid conditions, what we have seen in major deaths, most of the deaths is diabetes, and secondly, CKDs. Now, these two comorbid conditions are, percentage is very, very high in Goa. The current infrastructure which is in place for COVID-19, we have a different setup here. We have a first setup which takes care of severe and moderate cases, which I have put it here as tertiary and secondary care, and we have 1,471 beds here. We have something called as step-down hospitals, which has 557 beds. And this hospitals takes the patient from tertiary and secondary care. Whoever is getting better and whoever doesn't need to continue in these hospitals are taken down to step-down hospitals. Then third category of hospitals which we have are step-up hospitals. And this will take care of mild cases or, a symptomatic with comorbid conditions will be taken care by these hospitals. And these are mostly placed in periphery. And we have 130 beds altogether as a step-up hospitals. We have private hospitals, 428 beds. And this is, a good thing which happened in Goa. In second wave, almost around more than 25 private hospitals have come forward and they have started admitting patients. In the first wave, we had only 4 hospitals who were admitting patients, majorly, the major hospitals. And now in second wave, all even smaller hospitals as well as smaller, nursing homes have started taking on, patients. We have COVID care centers, 600 in numbers, 600 beds. And compared to in the first wave we had more than 1,500 beds as COVID care centers. But then looking at the percentage of people who are opting for home isolation facility, the number of COVID care centers have decreased in this second wave. This is how, I have put up a chart, a week-wise number of cases, which shows us a wave 1 and wave 2. If we see, compare just as an illustration, forget about the numbers, then definitely it shows us that like the second wave is almost 5 to 6 times higher than the first wave. May it be compared to number of cases, number of hospitalized patients, or number of deaths. This is the number of active cases from 1st Jan. And this is the map which we plot on a daily basis just to check where we are heading. Okay, and whether various precautions or measures what we take are helpful in cutting down our active cases or not. And if you see here in this active cases chart, somewhere around 12th of May, okay, that is almost on that, once what we see on a peak, we had our major restrictions in place. And from there, after the putting up of these major restrictions in place, definitely there has been slight increase in peak, and then we have come down within 1 or 2 weeks, and now definitely we are coming down very rapidly with number of cases. Okay. This is again a continuous chart of active cases. This is again just overlapping of active cases, just to show you comparative how badly we are affected with second wave compared to first wave. These are the areas of maximum active cases. Just to put 1 point here, when we started with the second wave in March and April, the initially the cases started coming up maximum in the areas which are city areas, okay, or urban areas. And then after almost 2 to 4 weeks, this particular outbreak has moved to peri-urban areas and coastal areas. And then at the third level, it has gone. Right now, it is coming up in our villages or in rural areas. But then when it has reached rural areas, already our cases in urban areas and peri-urban areas have started coming down. And that's how our active cases have gone down. The maximum active cases what we had in second wave was on 13th of May. That was 32,953 cases of active cases on that particular day. And now it is come down less than 15,000. These are week-wise positive cases, comparing wave 1 and wave 2. This is week-wise number of COVID-19 deaths. Okay, if we see the first wave and second wave. In first wave, we had maximum in a week were 61 deaths. And in the second wave, maximum what we had is 420 in a week. And that's a huge number of deaths. Now, one reason what we have seen here in second wave compared to first wave. In first wave, everybody was worried about COVID-19. The minute, they get symptoms, they were coming for testing. And the minute the symptoms were little more, they were restless and they were approaching our hospitals immediately. Unlike wave 2. Wave 2, there is a lot of complacency which is coming up in public, and a lot of people are staying at home even after having 3 to 5 days of continuous fever, even after having their pulse oximeter reading of around 90, 92. And this is why our number of deaths in second wave have increased. Now, just to give you a data on what I'm saying. So why I'm saying so, because there are so many deaths which have come as brought dead. Out of this 2,570 deaths till now, we have got 113 deaths which are been brought dead at various locations or various primary health centers or various district or tertiary care hospitals. So 113 is a huge number. It is a huge number. And all these deaths could have been, at least some percentage or a major percentage could have been prevented if they were brought to our services at earliest or on the first symptoms or first red signs. Second thing what we have seen is our almost more than 90% of deaths which occur even in this month. We have seen that all this more than 90% of people are not vaccinated. Maximum deaths are above 60. 1,570 deaths were above 60. So that's a huge number. And out of this, more than 90% of deaths were without vaccination or not vaccinated. So that is why as a whole, as a country, we have to focus on 45 plus vaccination. And even when it comes to 18 to 45, we have to focus on vaccinating people who are having comorbid condition. Because if we see every state, as Sir Muralidharan Rao sir has already said about underreporting, I feel purposely underreporting is really bad. But then for a good surveillance and to take action on your numbers, even if you get reporting 80 to 90% of cases or deaths, we can still take good action to prevent a particular disease. Okay, so that's why what I'm saying is more than 60 years of age, my deaths are almost 1,570, and out of 2,500 comorbid condition people are 1,939. That's a huge number. If we had to vaccinate all this population, okay, the 90% of deaths could have been prevented, and that is what my point is. And that is why recently state has made a task force as well as an expert committee to plan and prepare for third wave. And one of the point what we have put here in our expert committee is to vaccinate people from 18 to 45 as well as 45 plus who are diabetics, who are having chronic kidney disease, and who are having ISD with hypertension. We are taking this three most important comorbid conditions which have contributed to all our previous deaths, and we have to vaccinate this population to the tune of more than 90%. And if we success in doing so, then our hospitalization rate in third wave will be definitely will be low. Our death rate in third wave will be definitely will be low. Okay, this is again a slide where I have superimposed wave 1 with wave 2 with number of deaths. Okay, this is age-wise distribution in deaths in wave 1 and wave 2, and it goes almost a similar type of age distribution. But then what is disheartening or to look at is the age group of 45 to 60, which is in first wave was almost 28% of deaths, and in second wave is 31% of deaths. Secondly, another group is from 31 to 45, which was 8% before, and 11% of deaths in second wave. This particular population is a bread earner in the family. So this is the most active population of our community, and I think we have to protect this particular population. I put up a slide on a genomic sequencing data of Goa. We, all together had sent 171 samples to NIB Pune and NCCS reports of 59, and out of 59, we have got 19 positive for some of the other mutation. Now, if we look down at the percentages, okay, here, The UK variant, we have around 10%, but then most of these cases were tested initially in December and January month. And then later, whatever we have tested, we have got Indian strain as 1.6%, USA strain as 1.6%, Maharashtra double mutant was 8.4%, Maharashtra one of the single mutant was 1.6%, and other mutant was 8.4%. So definitely we are dealing with, in Goa is a Maharashtra strain, whether most probably the double mutant and the single mutant. And that is how our number of cases in second wave have drastically gone high, because this particular mutant strain, we all know that is very highly infectious. And that's how I can explain almost 5 to 6 fold rise in number of cases in wave 2 compared to wave 1. This is one slide showing up about the vaccination status, what is happening in Goa. From a population of around 15 lakhs, okay, we could administer total doses of 4,99,000, and yesterday's figure is it's already crossed 5 lakh doses. The first dose administered are 4,03,797, and second dose administered are 95,933. We have definitely started, with nationwide, even 18 to 44 age group vaccination. But then we all know that the dosage or vaccine is a problem here, and we are not getting adequate dosage as of now. And we have administered till now 32,991 doses in this particular age group. Definitely because of less number of vaccines, government is in process of prioritizing groups. So as I said, there will be 2 groups which will be prioritized. Still it is on paper, though we are yet to go ahead and get confirmation from Government of India and then go ahead with this particular prioritization for even for 18 to 44 age group. And we are planning of 2 age groups, 2 groups. One is lactating women till 2 years of lactation, and second group is 18 to 44 with diabetes, CKD, and ISD with hypertension. These are the 2 groups where we will be prioritized, so that our number of admissions and hospitalization comes down in wave 3. And secondly, we are vaccinating lactating women till 2 years of age, so that our neonates or children are less number of in wave 3, so that their hospitalization decreases in wave 3. Definitely, as a part of expert committee group for planning for the third wave, we have definitely planned for increasing our infrastructure with respect to NICUs, SNCUs, PICUs, and even oxygen beds when it comes to pediatric oxygen beds. We are not looking at only pediatric outbreak in third wave, but then yes, as of now, if we see our data out of almost the entire number of cases what we have got till date, almost around 12% of cases from positives what we have got is below 18 years of age group. And if I put it percentage from entire population of pediatrics or 18 below, it comes to fairly, roughly around 3 to 4% of the population, pediatric population, has been reported as positive. I multiply it twice probably for the third wave, and we are planning for around 10% of population which may be positive in the third wave, and where we might need 10% of beds at least, and almost 1 to 2% might need some critical care. And we are definitely planning for pediatric age group, as well as we are planning for the age group 18 to 44, especially who are having comorbid conditions. And probably a big chunk of third wave who will come for admissions will be 18 to 44 age group people who are having comorbid conditions, if we fail to vaccinate more than 60 to 70% of this particular age group. But before third wave, if at all we accomplish or we succeed in vaccinating this particular population to the tune of around 60% to 70%, I feel even the admission rate in even this age group will come down in third. But yes, even I say so, the third wave is definitely going to come. But then we are not very sure whether it will be much larger than second wave, whether it will be milder than second wave. But then yes, as a state, we will prepare for worst. We will definitely get prepared for worst, because from first wave, we definitely learned a lot of things, a lot of stories to remember. lot of learnings to take ahead. But then still we could not think about our second wave could have gone, may go 6 times. And definitely we were underprepared for the 6 times which have gone in second wave. Our hospital beds, our oxygen capacity all over India, and same was the situation in state of Goa. But then yes, we have managed till now, and we are geared up for third wave. Thank you so much. And this is from my side. And if any questions are there, there are a lot of points I have not touched, because if I go on speaking, it's almost a year of stories. So there are a lot of stories and a lot of learnings. It is not only for the state of Goa, but then every state has learned. I always, think that some of the states, it's unfortunate, but I put it as fortunate. Like Kerala, Chennai, they have been hit by various tragedies, various, disasters like floods, then all these cyclones and various things in a lot of years in past. And that is how their system has become robust. That is how their system is already in place. But then Goa never had, a tragic experience. Goa never had, burst of disasters in last, 10 to 15 years. Goa always have been, thankful to all these things that we never had a disaster. But then when you don't have major disasters, you don't get prepared. And now that we have seen this second wave all over the nation, definitely we will prepare for a worst case scenario in third. Thank you so much.
Thank you, Dr. Betodkar sir, for sharing the Goa model of COVID management, and sharing also the real fact check, which will definitely help all the medical fraternities to prepare for the upcoming third wave. Thank you for your valuable inputs. We will take 2 to 3 questions. I will request Dr. Gautamji Pathak to ask their question to Dr. Betodkar sir.
Thank you very much, sir, for providing such a great information in short period of time with thorough statistics. I want to ask, sir, please throw some light on post-COVID management, how we should go ahead with the patients and how we should manage the things and other to educate people. Thank you.
Yeah, Dr. Gautam, the thing is like, see, we have seen a lot of models all over India, but then we have failed. Sorry to say, we have, failed. There is not even a single medication where we could, stick to. There are so many medications came and gone. I feel, looking at first wave and second wave, is the complacency in system as well as in public should go down when it comes to third wave. Okay, some fear in mind is very good. So putting that in place, what I want to say is we have to focus at getting patients with red signs as early as possible in our system, or they should be admitted in somewhere, whether it is a primary care or secondary care or a tertiary care. They have to be brought in somewhere where a person from health, okay, or Department of Health or somebody who is trained can monitor him, 24/7. I think that is going to change our, scenario in third wave. Get people in system for monitoring as early as possible.
Okay, thank you, sir. I request Dr. Rahul Kulkarni, sir, to ask their question to P. Narahari ji, sir. Dr. Rahul Kulkarni.
Good afternoon. May I ask something? Hello.
Ask your question, Puneet ji.
Thank you very much, sir. Sir, मैं एक सजेशन देना चाहता हूँ. एक ट्रीटमेंट होता है अल्कोहल इनहेलेशन करके, तो इट इज डायरेक्टली एडमिनिस्ट्रेटेड टू द लंग्स, और उससे हम वायरल लोड खत्म कर सकते हैं जो लंग्स की वजह से बहुत ज्यादा फ्लूइड रिटेंशन हो रहा है, कंजेशन हो रहा है ऑर्गन्स का, और यही सबसे बड़ा रीजन है डेथ्स का. अभी तक इस पॉइंट पर कोई रिसर्च नहीं हो पाई है इंडिया में. सर, मैं रिक्वेस्ट करता हूं कि इस पर काम होना चाहिए. ये बहुत ही सेफ है और ये तुरंत वायरल लोड को खत्म कर सकता है।
Okay. Dr. Vishnu Bhavne sir, ask your question to Shri G.N. Rao sir.
Ha, namaste sir. My question is, sir, what is the future plan of DRDO to boost up the medical infrastructure?
Yeah, now we are making more oxygen plants at a district level. Now we have provided to the big hospitals in the cities right now, and Medical and Health and Family Welfare Ministry has identified 500 district level hospitals all over the country. For those hospitals in the categories of 100 beds, 50 beds, 30 beds, we have categorized to have oxygen plants of 1000 liters, 500 liters, 250 liters oxygen plants. So we have already geared up with the 15 industries for making these oxygen plants in the next couple of months. So by July, we'll be completing this manufacture of these plants. And as per the priority and the list given by the Ministry of Health and Family Welfare, we'll be distributing these plants to them. And PM CARES Foundation has given the mandate and funds for this one. And for testing, we'll be continuing to increase our testing support to the state governments and the health infrastructure of the different states, so that our local hospitals or medical labs which are having at the different places, they will support for the local testing and the sanitization, personal vehicles, offices, equipment, goods, files, for all these things, and shelters for the automatic sanitization with the controlled spray which we have given. It has also been used in a big way. And masks and PPEs, we continue to certify different vendors which are coming to make, so that they can be distributed and marketed. Then oxygen cylinders, we will be increasing the production so that in future there will no scarcity for the oxygen cylinders for the patients, and they can administer themselves, because many doctors are advising that to reduce the load on the hospitals, people should be taking oxygen support at home and manage the COVID-like symptoms. To help these small cylinders, which we are designed and making through the industry, that number also will be increased, so that there is no dependency for the patients to go to hospital and ask for the oxygen. These are the various methods we are increasing our participation through technology for these anti-COVID activities.
Thank you, Rao sir. I will ask Dr. Padaya sir to ask their question to P. Narhari ji. Unmute sir. Padaya sir, please unmute your call. Bipin ji, unmute them.
Okay. I mean, I have one important suggestion in the sense, when I actually observed the whole scenario for the first wave and the second wave, what is happening is, for 90% of the people with minimum medical assistance, they are coming out of this COVID infection. And for the rest of the people, they are becoming critical. And some people, in spite of all the best medical care and all that thing, they are dying. And this is basically because of the genetic susceptibility of these people. So my suggestion is, in future, we have to have the genome studies of the entire representative populations of the whole of India, so that in a few hours time, we will know, once we have the data, who are the people who are susceptible in spite of all the best medical care. Anyhow, this is a long-term thing. It's not an immediate thing, but in the long term, we have to have these genomic studies of different populations of India. Then we will immediately know who are the people who are susceptible for any kind of eventuality, not only just for this COVID-19, any kind of eventuality. And the government of India, as a long-term strategy of building the health infrastructure in the most perfect way, This is the ultimate thing that we need. That's the thank you very much.
I think there are no any questions. If there are any question, you can mail to Narahari ji sir. I would like to ask Narahari sir that how can we boost up oxygen availability in rural areas, like difficult areas, Adivasi area? How can we reach there or ensure oxygen availability there, sir?
See, the best thing to do is to ensure that our district hospitals and community health centers, like if we are having a 60-bedded hospital, now that's what is the minimum. If we having a 60-bedded hospital, like any civil hospital or district hospital or a community health center generally has a 100-bedded hospital. So we must ensure that we have a dedicated air separation unit, or at least there must be some, we need to create an oxygen tank which can be continuously supplied with liquid medical oxygen. If we can do that, and each of the beds in such hospitals should be having the pipeline system established, which can supply oxygen to the patient. So my suggestion would be, that's what in Madhya Pradesh we are thinking of, is to ensure that each of our district hospitals and community health centers, at least with 60-bedded such hospitals, should be having, we must ensure that at least from now onwards, there is a running liquid medical oxygen available.
Thank you, sir. Now we are going towards the conclusion of this program.
Swapnilji, I think 2 more raised hands are there. One is Dr. Rahul Kulkarni ji and Mr. Prasad Peketi.
Okay. Prasad ji, ask your question.
Sir, namaskar, and thank you very much for this excellent session. So one question is especially from the Goa and MP, how are you able to curb the black marketing of the drugs? So that is a one problem that was very, very severe. Even in Hyderabad, we faced that one. And even the second one is from a technology side, can we implement any blockchain kind of a technology with the drugs manufacturers so that we can control this black marketing?
Yeah, it's a very difficult question, actually, to be very honest. The demand supply, there's been a huge demand supply issue. The demand was so fast created and the supply was so limited in nature. So the problem with the medicines, especially like remdesivir or tocilizumab, or now we are seeing for black fungus, the amphotericin B, the problem is that the number of cases which are coming up has been so fast, and all these medicines have a shelf life of a maximum 3 months. So no manufacturing company ever produces and keeps these medicines ready to be sold in the market. And any medicine, let's say remdesivir, any medicine like remdesivir takes 14 days to be actually manufactured. I mean, today they start, then on the 15th, 16th day, they will be ready to deliver. So medicine is not something which can be instantly prepared and, immediately delivered in the market. So these issues have been really, really huge. In Madhya Pradesh, I'm not claiming that we have been able to really curb, but yes, in Madhya Pradesh, we ensure that the drugs are given only on prescription by a hospital. It is by the hospital. If a patient is there in the hospital and is admitted in the hospital, and the hospital has to give a prescription, and through the stockist or the medical store, it has been supplied. And there has been a lot of, rationing which was done to ensure that the only needy are actually getting it. But then again, this is an eye-opener for all of us. We need to We need to enhance our pharma industry's potential. We need to ensure whether it is oxygen, medicines, any of these things. This is an opportunity, I would say, that we have to enhance our facilities. We need to really spend a lot on the health sector.
Okay, thank you, sir. Now we are taking last question. I request Dr. Rahul Kulkarni to ask their question. Dr. Rahul Kulkarni.
Thank you, Dr. Swapnil ji, for organizing this nice session with a very good, nice information. My question to the chairperson, DRDO, Reddy, Dr. Reddy, sir. Sir, first, thank you to you for giving me opportunity to monitor and coordinate the all research of D2 glucose drug in the Maharashtra. I'm very much thankful to you. I'm proud that I am a part of DRDO team for this research. My simple question is regarding the way remdesivir and amphotericin scarcity is occurring due and oxygen also due to transport and everything. So can we ensure this should not happen with?
I'm not able to hear the question. Not audible.
Sir, can you hear me?
Loud, please, speakly, Kulkarni sir.
Hello. Hello. Can you hear me, sir?
Yes, you are audible.
Sir, my question is the way scarcity of oxygen, amphotericin B and remdesivir occurred. So how can we ensure the sufficient and efficient supply of the D2 glucose drug throughout the country when if there is a third wave?
Rao sir.
Yeah, this 2DG drug, now Dr. Reddy Labs is taking, see they will be releasing every week in batches to see the scarcity is met, so that there will be a continuous supply, and this is through hospitals only. This is not through any civil or not across the counter. So that way each hospital should estimate and apply to the company and get the drug. You place orders, immediately next week you will get the drug. So that is how this black marketing or hoarding and this thing will be eliminated. And the cost is also already put on the web, and it is very economically placed. So supply is ensured that way to directly to the hospitals with the doctor only directly administering the drug. So that is how we are at least planning to counter the demand supply deficit, black market and other practices which are creating trouble for the patients. For oxygen, I think Ms. Narhari has already told how they are employing different methods for transportation, because generation there is no problem. We are excess in generation, as he has pointed out. But getting the oxygen to the place where it is required, that is a challenge. And recently government has imported many number of tankers and all those things. And supply is also now almost streamlined, I think. And in addition to that, the plants which we are supplying every district hospitals will work as a backup and standby in case of emergencies, and where the storage supply is not there. So hospitals will not feel the dearth of oxygen. In addition to that, the hospitals where piping system is not there, we are going to provide a compressor and the cylinders also, so that they can fill the cylinders, keep it ready and supply to the villages, district hospitals and other taluka hospitals and medical and health centers which doesn't have this facility of distribution. So these hospitals where this compressor is available, they can fill the cylinders and distribute within a short time to the nearby places wherever it is required. So this is the immediate and long-term strategy for generation and distribution of the oxygen across the country at district levels, so that they are not dependent on a big supply chain and getting into the choked supply chain management. But supply chain management for the bigger centers is also augmented, as Ms. Narhari has told, and everything is streamlined across the country for the immediate and the next wave also.
Thank you, sir. Thank you, sir.
Thank you, Rao sir. Dr. Balramji Bhargav sir, ICMR head is already in meeting. So now we are going to close this session. In future also, Bharat Niti is going to organize such a expert series session on various topics. Now, vote of thanks. I would like to thank every honorable speaker, Shri P. Murlidhar Rao ji, P. Narhari ji, Dr. Utkarsh Betodkar sir, Shri G.N. Rao ji, and all the participants for joining this expert series. Thank you so much on the behalf of Bharat Niti. Thank you.
Yeah, thank you so much. Thank you.
Thank you, sir.
Thank you. Namaskar.
Namaskar.